So far, we have talked about the life cycle of influenza, how to distinguish influenza from pneumonia, and how to treat influenza. Now, let's take a look at how we can use risk stratification tools to assess a patient's risk with pneumonia and aid in determining setting of treatment. Now, at this point, you should know that there are 4 different types of pneumonia. There's community-acquired pneumonia, there's healthcare-associated pneumonia, there's hospital-acquired pneumonia, and there's ventilator-associated pneumonia. Now, keep in mind that the severity of illness is different in different types of pneumonia. So here on the y-axis, you can see the mortality rate. So in community-acquired pneumonia, the mortality rate in this study was about 10%, which was significantly lower than a mortality rate in nosocomial pneumonia. Now, on the other end of the spectrum, we have ventilator-associated pneumonia, which has the highest rate of mortality compared to other types of pneumonia. So I would rank different types of pneumonia like this. Ventilator-associated pneumonia is the more severe disease, and community-acquired pneumonia is a less severe disease relative to other types of pneumonia. So if community-acquired pneumonia is a less severe disease, where exactly should patients with CAP be treated? Now, of course, the decision to hospitalize the patient ultimately depends on the clinician's judgment. So clinical judgment is important, but there are also some tools that can be used in order to aid in making that decision. So there's the Pneumonia Severity Index, or PSI. It's also referred to as the PORT score. And there's the Curve 65 score. Now, these scores are just to help. They are not to replace clinical judgment. The Curve 65 has not been as well validated as the PSI score, but because Curve 65 is more simple, it's more practical to use at bedside. So when a patient with CAP is presented, the severity of illness is assessed, and then the patients can, generally speaking, be in 3 different groups. So there could be the low risk group, moderate risk group, and high risk group. Now, low risk group patients typically can be treated as outpatient, unless they have an contraindication to outpatient, in which case they will be admitted to the hospital. For example, if a patient cannot take oral medications, then they need to be admitted to the hospital in order to receive intravenous antibiotics. And when we say outpatient treatment of patients, it basically means the patient will receive a prescription for antibiotics and they get discharged and they go home. Or if the patient is at the primary care physician's office, they receive a prescription and then they go home. Now, in moderate risk and high risk patients, these patients typically need to be admitted to the hospital, and in some severe cases, the patients need to be admitted to the ICU because of the hypoxia. Now, it doesn't mean that all high risk patients will be admitted to the ICU. This will basically depends, on the case by case basis. Now, the 2019 IDSA guideline for CAP actually prefers the PSI over the Curve 65 score to determine the need for hospitalization in adults diagnosed with CAP. So here's what Curve 65 is. So the C stands for confusion. So if the patient has altered mental status, they get 1 point. The U is for uremia or BUN of 20 or higher, which will give you 1 point. The R is for respiratory rate of 30 or higher, which will give you 1 point. The B is for blood pressure of 90/60 or less. And of course, the 65 is for age 65 or higher. So once you calculate the patient's Curve 65 score, if they get a score of 0 or 1, the risk of mortality is about 1.5%. So because the mortality risk is low, the patients may be treated as outpatient. Of course, not to replace clinical judgment, but generally speaking. And a score of 2 or higher, basically mortality rate approaches 10% or higher, and that's exactly why the patients typically are admitted to the hospital in order to closely monitor them to make sure that they do not clinically deteriorate. And here's how the PSI score looks like. As you can see, it's very complicated. So you do not need to memorize this. There are online calculators that you can use if you wanted to use the PSI score. Now, the 2019 IDSA guideline for CAP uses the same criteria as the 2007 guideline for classifying patients as severe community-acquired pneumonia. So there are two major criteria and there are several minor criteria. So if the patient has one of the two major criteria, it will be considered severe pneumonia. And basically severe pneumonia, for the most part, the patients will likely need to be in the ICU. So as you can see, the criteria here is a septic shock with need for vasopressor. So this can only happen in the ICU, and of course respiratory failure requiring mechanical ventilation. So both vasopressor and mechanical ventilation will require patients to be admitted to the ICU. Now, if someone has three or more minor criteria, they will also be classified as severe pneumonia. However, depending on the minor criteria, the patient may not necessarily need to be admitted to the ICU. But the reason I am mentioning these criteria for determining what's severe cap and what's non-severe cap is that the treatment actually depends on it. So the treatment for severe cap might slightly be different than the treatment for non-severe cap. So if someone does not meet these criteria, they will be considered non-severe.